today, Dr. Jaswant Patil. His topic is Beyond Tumor Biology, Integrating Homeopathy and Mind-Body Science in Conventional Cancer Care. We look forward for your address, Doctor.
Hello friends, dignitaries and our dynamic leader, Dr. Subhash. This is the second conference that has been arranged to mind body. Mind and body are always together. Mind is treated, body is not treated, body is treated, mind is not treated, the treatment is incomplete. So the objective of my presentation is to scientifically explore and demonstrate how evidence base is good. Beyond the tumor biology, just by integrating mind and body, what we can do, that is I'm going to talk to you today with my journey from allopathy to homeopathy and to the integrated treatment. A small story, my mother was absolutely on a deathbed in my own ICU and I was weeping. Somebody suggested homeopathy and one dose of arsenic iodide reduces. From the tears, it was a happiness. And I said, wow, I have worked 5 years in ICUs. And I have never seen this recovery. And that inspired me to adopt homeopathy. Started with the integration of 1 dose of homeopathy and 15 medicines of allopathy. And finally I saw that when a patient came in my ICU with a heart attack, inferior wall myocardial infarction with complete heart block, no one can save unless he has no money to thrombolize and he has no money to pacemaker implantation temporarily. And finally, 1 dose of cactus tea and arnica repeated 3 times. And in the evening, the isolated changes became normal. It was a surprise to me as a cardiologist, and that put me more into the homeopathy. Then came the integration. In integration, I had given homeopathy and allopathy together, and to my surprise, my OPD increased from 30 to 150. But the financial ruin was indoor patients reduced from 20 to 0 to 1, and I had to literally close down my. So this shows that what is the effect and power of homeopathy, if integrated, will lead to the complete recovery. In the last 4 decades of my work in oncology, I have seen that the integration of oncology, highest response rate, better tolerance, better immunity and reduce toxic side effects, improves quality of life, support functional recovery and mitigate the treatment dropout. We continue. I am going to show you some clinical cases and what worked, why did the single medicine did work in some cases and why integration succeeded. Classical homeopathy alone marvelous results, but success rate was less. In homeopathy, individualization and emotional profiling, the results were best, but again, there were success rates and compared with the failure rates. Because success depends on a physician, and we must have something which every homeopath should treat and give the results. So integrative approach was with conventional medicine was the best option in stage 3-4 diseases. First stage, it may give good results, but even in the left out hopes where allopathy has no answer, these cases I am going to show how they improved and how well they worked. The scientific rationale behind the integrative oncology, that it is one path, together we can live and reducing the side effects, longevity and the better quality of life. So we have to unleash the dynamic power of homeopathy, so nanomedicine in cancer, revolutionizing oncology integrated treatment. Supportive role of homeopathy during cancer treatments reduces chemoradiation effects, strengthens immunity, supports emotional balance, and reduces long-term complications, helps restore the body's health. Now, how it works? We have to give a scientific explanation today. And it causes immunomodulation, TH1 and TH2 balance, then epigenetic regulation, hormesis, a low dose which has been shown and improved in the DNA repair. I have done recent research, it's not been published and it's going to, I have sent an abstract and everything. But I have seen in that research, I have taken Thuja 60, 200, 1M, 10M and seen a mother tincture. And only in the cell lines of adenocarcinoma, I got a result with only 60 potency. So I realized if we use pathological prescription, 60 works better. And that is only one research I have done. Words are lacking, and we can do the more research and show which potency improves and what potency helps at mind level, body level, and at a complete health. That is more important. So these are the references, what I am telling you about this. These are the references that how I have arrived at taking research, searching the research gate and finding out the total solutions. Hormesis in cancer, as hormesis gives rise to the more the lower potency, better in the pathology, but more the diluted potency, better at the mind level. So the J-shaped biphasic wave or U-shaped dose response curves, you can see how it is giving the best results. And immune means how hormesis is based in homeopathy helps. First is the immune activation. The whole you can read and see where Thuja is the immune gene modulation, carcinosis is the immune balance, and arsenic album is the immune stabilization. The redox balance and antioxidant upregulation, where we see that the low dose of homeopathic signals activate all these immune modulators and gives rise to good results, and we see that in the mitochondrial repair, medicines are arsenic album, carbovage, and selenium. DNA repair enhancement, apoptosis induction, where Thuja is there, and here we can see the Ruta. Thuja and Ruta are the two main remedies for the cancer, which I have got many times success, but given in 6 potency, not in 30 and all those things. So homeopathic medicines in integrative oncology, carcinosis brings the immune balance, Thuja in vitro, anti-proliferative effects, Ruta apoptosis. Hydrastis, digestion, mucosal supports lux vomica, gut and liver modulation. Arsenic album, oxidative stress and anxiety control. Now this mind is controlled with the arsenic album. In every case of cancer, we have to give one mind remedy. Constitutional should be given after you start getting the better results. And the pathological remedy and symptom minimum with the acutes when the pain is more, it quickly relieves within minutes all the pain and sufferings. So immune modulation in cancer suppresses Th1, rate is increased and NK is decreased. Homeopathy supports this to give rise to the immune recovery. Now ethical integration. We should be transparent. There should be proper data, evidence-based data, patient context. Never delay or replace the standard treatments of allopathy, because always integration in such cases is best. Now we get individual, I have got many individual cases only cured on homeopathy, but the stages has to be followed because we can't take risks. Till the time homeopathy scientifically gets recognition, we have to follow integration. So do not overpromise. Early appropriate place selection may improve the support, and ensure regular medical monitoring with imaging, blood tests and pathology. So I will show you this is a case of craniofaringioma completely recovered by classical homeopathy. She is a case who was operated twice. Finally she was given up hopes. The neurosurgeon called me, my dear, I am unable to do anything. Can you do anything? The mother is crying and we have no options. So I will send her, I am sending her home. If you can treat at home, it will be better, because they are poor and they are not affording now. And we started. After looking to that, you see this treatment as skeleton, 28 kg weight, Thuja, Nux mosquita. I attended one lecture of Dr. Dubey. He said, "First, sab sapata or bimari ka rapata." And that word was fixed in my mind, and she was fitting into Nux mosquita. You see, within a year's time, Only what was damaged was optic chiasm because she was operated twice and the tumor was sitting top on it and it was causing a blindness. This could not be recovered, but you can see the marvelous change, and that is the dynamic power of homeopathy alone. When it will be combined with the integration, it will give the best result. Then second case, cancer of vocal cord. You can see that he is my second cousin, very close family member, 35-year-old. He had a cancer on the vocal cord, and it was diagnosed by ENT. He said it is 100% cancer, but we have to do biopsy and check it. I said, wait, we will see, because the growth you can see. You can see the arrow mark. There is a big tumor there growing, and he said probably he has got the lymph node also palpable, and we have to remove the larynx. And it was a great trouble for him. How this is possible? He lose the voice, and 35-year-old will lose everything if he is not able to speak. We started the treatment. I will say, I will not take the risk with you. I will start the treatment. 2+6 was given, and every week we did a scoping, laryngoscopy to see. I told him that because he was my patient, that he had surgery, he was giving me correct guidelines. Otherwise, there is no improvement. He said, Jaswant, there is slight improvement in the cauliflower growth. So there we have seen that the disease every week and 1.5 years time, finally you could see that all has been gone. And finally on the hands you can see the eruptions. Okay, so this is a pre-treatment, this is a post-treatment. And you can see the normal total. This was a eruption. And eruption comes in the cancer cases. You can assure that it has been completely treated. And this finally, as per Hering's law, today is more than I think 20 years without a relapse. So that was a universal power of homeopathy without any help. No alternative therapy, only on homeopathy. Now I showed you the strength of homeopathy as alone, and if this is combined with the strength of conventional science, the results will be marvelous and we will save so many lives, morbidity and mortality. So the third case is also of vocal cord tumor. Now I have learned during the COVID time that single remedy doesn't work. We lost cases, and then of course they were taking conventional also. But after I started listening to Dr. Halima's line, dare to be wise, but we rarely dare to be wise. And I said, I don't want now, I go clinically and start giving. So what was COVID? Either it was biting the vessels or licking the nerves. These are the two basic pathology. So based on that, I searched out for what are the blood vessel inflammation rubrics and nerve damages. So both together, pathology, wherever the symptoms are similar, like patient-wise the symptoms they change, but the base should be the pathology. So what is the overview and what is the corresponding place, that is more important. And accordingly, this is the same case which I got, that required 1.5 years, but using the multiple remedies, and this was in 2 months' time. So you can see here also, Thuja was here, constitution also Thuja, pathological also Thuja, so you don't have to change the remedy and give. But here, it was going into a very difficult state, so I have given the whole remedies that I have given, arsenic, alba, belladonna, lidopal, opium, platinum 30, because as per the given examples with the medicines prescribing points which are written here. Learning from this complete recovery, see within 3 months' time, and more pathological, clinical, and complementary remedies, as compared to other vocal cord case that I have shown you earlier, which required 1.5 years of classical approach. So these are the cases I am experimenting, finding out. Don't be there. You have to find out, you have to experiment, dare to be wise, and cross the limits, cross the boundaries, and see whether it is working or not. In a given up home cases as well, they are going to die. It's been given up. So now this is the fourth case. This is a case of integration. Glioblastoma, fast growing tumor, hardly anyone survives, but she was operated, again the relapse came. Irradiated, again the relapse came, and finally she was put on homeopathy. I said you continue what they are doing and continue with homeopathy, and you see that everything has improved. Then androgynous mass into the ovarian cancer. Ovarian cancer, metastasis all over metastasis. She was on deathbed. Patients, son came and asked for the medicines. I said, I don't know, but everything is given up. This was again a classical case. Senecia 30 was given and repeated twice in a week for that. And you can see the next scan with repertorization shows complete recovery in symptoms and significant recovery radiological regression of all the metastases everywhere in the body. So that promoted me that yes. So from here what we know, importance of mind. Senecia was given just on the mind, and we can see. But the duration, the success rate and everything, I think integration will make a major change in the world if everyone comes and adopts and finds out the way, sitting and discussing everything. Now homeopathic prescriptions are to be considered properly when the right time comes. Now, there are so many cases, but I have to see that only 4 minutes are remaining, so I will go to the final things. This case. This is a case of CA esophagus with metastasis in this. He was from Dubai, he came to India. I said, he has come and you treat me whatever the cost is. And we started treating him. He was unable for surgery and cannot be radiated. So after this, we gave him the multiple remedies here again. And you can see the recovery in this sense. See from this to this, and that is the strength of the prescription was given, carbonic lymph node cancer, opium fried, green, so mind, body, and everything is done. And maybe he got this because he had an anxiety for children. And Senecia was security when that came. The tumor started getting septic, and the discharge was great. And after that, when discharge was fast and closure of the thing. So there are this. So the mind and the body, how it can cause a problem. And these are some slides that I am showing. Liver cancer is big financial loss. So there are multiple things that I have decided. Which cancer will happen due to what? So why left breast cancer? Why right breast cancer? What is the problem at the mind level, at the emotional level? If you consider that, you get the best results. So this is a testimonial.
Good afternoon, myself Dr. Sanjeev Zurbala. I am a neurosurgeon at Jalgaon since 1990. This story of my life, which happened to be on 5th of October 2021. With my son, I went for swimming, and there was at the swimming tank on the I put chlorine poisoning. I started suffocating, I had severe bronchospasm, hypoxia, disorientation. So I drove my car, went to Sahयोग Critical Care Jalgaon at the ICU, and at the doorstep of ICU I just collapsed. My pulse was not recorded. I was taken inside, I was intubated and put on ventilator. And during admission, I had grade 4 cyanosis and started uploading of eyeballs with this cerebral posture. So immediately allopathy started, steroids, ventilator, and my saturation was not coming up and my condition was very critical. Meantime, Dr. Jaswant Patil, my close friend, got the news and immediately sent the medicines, homeopathy, at the ICU and started putting drops and medicines sublingually. Meantime, Dr. Jaswant's sister, Dr. Anjali Patil, she is a very good meridian expert. She came over in ICU and she started meridian therapy on me. she started removing my blocks called as meridian blocks. So initially she opened the lung point called as lung 1 point at lateral end of clavicle. Then she opened the bladder point at the middle end of
This is TCM.
scapula, and subsequently she opened the kidney meridian at the umbilicus and supraumbilical. Subsequently she opened Brahmarandra chakra, anatomically called as anterior fontanelle, and she put the needles in anterior fontanelle. I was sitting on ventilator for 2 days, and I subsequently started recovering. And on third day I was completely recovered. My vitals were normal. I didn't develop any complication, no ARDS. Fortunately, fourth day I was so stable that one patient came in ICU and immediately he was required neurosurgery. So I myself did neurosurgery on that patient and he got completely recovered. So this is the experience of life.
Surgery from ICU. And
it was possible because of
where no one can get. And he was not responding even to 5 T pressure of the ventilator.
without any complication.
And finally we got the results. And this is how integration has helped, because we have to buy time to save the life. And time is given by conventional medicines and dynamic power is given by homeopathy. So both they marry together, they will be the best products. Thank you.
Sorry, I have completed 20 hours for me 20 minutes.
God, that was such a mind-boggling, awesome presentation and fantastic cases, really. Thank you so much for sharing. Lots of gratitude to all our speakers today. I would like to now invite Dr. Dennis to conclude the session.